It's natural to have questions, especially when it comes to our health. To help you make an informed decision about the COVID-19 vaccine, let's look into how it works, how it was developed, its risks and benefits. First, we need to understand that COVID-19 is the infection caused by the 2019 novel coronavirus. It mainly affects the lungs and can also cause damage to the heart, brain, and other organs. It's characterized by fever, cough, shortness of breath, and several other symptoms. Health outcomes range from mild to severe, including hospitalization, ICU admission, and death. Complications from COVID-19 can include serious conditions like pneumonia or kidney failure, and in some cases, death. There is no specific treatment for COVID-19. The majority of COVID-19 cases are mild, and most people who get it will recover on their own. However, an infected person can spread the virus to others who may be more vulnerable and more severely impacted. Though most recover quickly, some people have symptoms for several months after having the COVID-19 infection. Long-term symptoms may include extreme tiredness, cough, shortness of breath, pounding heartbeat, dizziness, headaches, sore throat, fever, chest pain, joint pain, or rash. Vaccines help prevent serious health outcomes. Both the Pfizer-BioNTech and Moderna vaccines are mRNA vaccines, provided in 2 doses by a needle in the upper arm. mRNA vaccines do not contain the virus. They teach our cells how to make a protein that will trigger an immune response. Once triggered, our body then makes antibodies. These antibodies help us fight the infection if the real virus does enter our body in the future. As with any immunization, when you receive a COVID-19 vaccine, protection from infection does not happen immediately. Immunity develops over time. The COVID-19 vaccine is 60 to 80% effective at preventing COVID-19 infection 3 to 4 weeks after receiving a first dose. Following the second dose, vaccines have been shown to be over 85% effective. Optimal protection is reached once 14 or more days have passed since the second dose. This is when a person is considered fully vaccinated. In order for the vaccine to be effective against the Delta variant, individuals need the optimal protection of being fully vaccinated. An individual is also considered fully vaccinated 14 days after 1 dose of a single-dose vaccine, such as the Johnson & Johnson COVID-19 vaccine. Individuals who received a COVID-19 vaccine outside of Canada that has not been authorized by Health Canada should consult their region's public health authority for information on what is considered fully vaccinated. You may be wondering if the COVID-19 vaccine is safe. Yes, getting the COVID-19 vaccine is a safe way for people to protect themselves from severe illness. All vaccines in use in Canada have been approved by Health Canada. Health Canada only approves a vaccine if very robust scientific data and evidence show that it's both safe and effective. After approval, Health Canada and the Public Health Agency of Canada continue to monitor the ongoing safety and effectiveness of all approved vaccines as millions of Canadians are vaccinated. The COVID-19 vaccine does not and cannot change your DNA in any way. The vaccines only contain the blueprint to make a protein on the surface of the COVID-19 virus, which is harmless on its own, so that your body will create antibodies that will recognize and attack the real COVID-19 virus if you are ever exposed to the virus in the future. You cannot get COVID-19 from the vaccine, and there's currently no evidence that any vaccines, including the COVID-19 vaccine, cause fertility problems in women or men. The vaccine is safe and recommended for pregnant people because they're at higher risk of complications if a COVID-19 infection occurs during pregnancy. COVID-19 vaccines can also be safely given to breastfeeding people. Antibodies that a vaccinated pregnant or breastfeeding person makes are likely to pass on to the baby. This is safe for the baby and helps protect the baby from COVID-19. Have you ever wondered how the vaccines were developed so fast? It's true that vaccines do usually take longer to develop. However, the COVID-19 vaccines were developed quickly for many reasons. Because of the scale and urgency of the COVID-19 pandemic, there's been an unprecedented level of international collaboration among scientists, health professionals, researchers, industry, and governments to find and produce effective vaccines that can help end the pandemic. Under normal circumstances, the search for funding can significantly delay researching and developing new vaccines. The research and development for COVID-19 vaccines received increased dedicated funding. And because we're currently in a global pandemic, there have been many willing and available trial participants, which allowed for a rapid setup of clinical trials and quick recruitment of participants. Although the word mRNA is new to most people, the fact is that mRNA research has been going on for decades. Scientists have been able to quickly adapt previous research to create the vaccines we're using now. Before approving a vaccine, Health Canada reviews the evidence, including results of clinical trials, to determine if a vaccine product is safe, effective, and manufactured to the highest quality. The COVID-19 vaccines had reduced time delays in the approval processes because Health Canada was able to begin reviewing data as it became available throughout the process of clinical trials, instead of waiting until all clinical trials had been completed before beginning the review process. The bottom line is that no corners have been cut on safety or approvals. The new COVID-19 vaccines have had to meet the same rigorous safety and effectiveness standards that all vaccines have to meet. The clinical trials show that the vaccines are safe and effective, and all steps to evaluate the safety, efficacy, and quality were met in the approval process of the vaccine. Furthermore, billions of people have also now been vaccinated against COVID-19, which Health Canada and the Public Health Agency of Canada continue to monitor. And all evidence to date has confirmed the findings of the clinical trials that the vaccines are safe and effective. There are many benefits to vaccination against COVID-19. The vaccine has been shown to be effective against the Delta variant and other currently known variants for individuals who are fully vaccinated. As with most vaccines, there is a small chance that cases occur in fully vaccinated individuals. These are called breakthrough infections, and they occur most commonly among elderly populations and other vulnerable people with a lower immune response to vaccines. However, even in people who experience a breakthrough infection, the vaccines are shown to reduce the symptoms and severity of illness. This in turn reduces transmission because with most variants, those with a breakthrough infection tend to have a smaller amount of the virus present in their bodies and release less of it while they talk, exhale, or do other normal daily activities. Vaccines are most importantly intended to prevent severe illness, hospitalization, ICU admission, and death. The COVID-19 vaccine is doing that very effectively. Increasing the population rate of full vaccination will help ensure hospitals don't become overwhelmed. As more and more people receive the COVID-19 vaccine, we come closer to achieving herd immunity, which happens once enough people are immune to a disease, making it harder for the disease to spread. Unlike COVID-19 infection, the COVID-19 vaccine creates immunity without causing severe disease, hospitalization, or death. If you have had COVID-19, the vaccine is still recommended because natural immunity from COVID-19 infection may not last long, making it possible to get it and spread it again. Along with the benefits come some possible side effects or reactions to the COVID-19 vaccine. Some people may experience side effects from the vaccine within 1 to 2 days of vaccination, but these will likely be mild to moderate and resolve on their own after a few days. The most common side effects include pain, swelling, or redness at the injection site, headache, tiredness, muscle or joint pain, chills, mild fever. It is important to receive the second dose even if you experience mild or moderate side effects. You may get the same side effects with your second dose. The short-term side effects of the COVID-19 vaccine are less than the risk and potential long-term health damage caused by the COVID-19 virus. Long-term side effects are not expected with the COVID-19 vaccines. Severe allergic reactions are rare, but can occur within 2 hours of vaccination. They include hives, swelling of the mouth and throat, trouble breathing, hoarseness, or wheezing. Serious side effects are very rare, but can occur within days or weeks of vaccination. They include fever over 40 degrees Celsius or 104 degrees Fahrenheit, flu-like symptoms, extreme tiredness, severe vomiting or diarrhea, seizures, other unusual or unexpected events. Very rarely, the AstraZeneca vaccine has been associated with a rare form of blood clotting after vaccination. Out of an abundance of caution, Ontario is no longer administering first doses of the AstraZeneca vaccine. Cases of myocarditis and/or pericarditis following immunization with COVID-19 mRNA vaccines have been reported in a small number of people in Canada and internationally. These reports are very rare, and investigations into the association between myocarditis or pericarditis and mRNA vaccines continue. Health Canada reassures Canadians that COVID-19 vaccines continue to be safe and effective at protecting them against COVID-19. The benefits of COVID-19 vaccines continue to outweigh their potential risks. If you experience a severe allergic reaction or serious side effects, you should seek medical help immediately. Do not get a second dose of the vaccine if you have serious side effects following the first dose. Speak to your healthcare provider for advice. This has been a lot of information. It can feel overwhelming, and these are stressful times. You're not alone. Reach out to your local helpline to find support. Taking care of your mental and physical health is important. Here are some tips to help you make an informed decision when researching information about the COVID-19 vaccines. Look at the web address. Is it a credible site? Check the date and author. Is it outdated information? Is the author a respected expert in the field of vaccination and infectious disease? Headlines are often sensational to grab attention. They often don't tell the whole story, so read the full story to make sure you understand the information in its full context. Is it fact or opinion? Look for the original source. Is the author trying to sell you something or promoting their own product? We're bombarded with information these days, from our friends and family, through the media, and on the internet. It can be difficult to sort out what is high-quality information from low-quality or misleading information. If you have questions, ask your healthcare provider, your local public health agency, or a fact-checked website. Remember, vaccination is the best way to protect against severe illness and hospitalization from COVID-19 infection, including the Delta variant. It takes at least 2 weeks after getting a vaccine dose to be protected, and each person that gets vaccinated brings us closer to achieving herd immunity, making it safer for the community so that certain measures can be lifted and we can gather and carry on our day-to-day activities safely. If you have questions, contact your local public health agency or speak to your healthcare provider.